Thank you, Mr. Chairman. I rise to give my no vote explanation and explain why I'm opposing the DCH budget. Considering the deep cuts made to the Department of Community Health budget in fiscal year 2012 and the budgets over the past years, this budget has really been called somewhat of a so-called increase, but yet there's still much improvement to be made. There's still a long way to go before the department is made whole again and adequately funding the vital programs it provides, and until then, I can't say that this is a good budget. And to the chairman of the committee, I do appreciate the restoration of the funding for the graduate medical education and community mental health for special populations. With the potential expansion of medical care needs resulting from the Affordable Care Act, it is vital the state has an adequate number of medical personnel. To that same end, though, if we're willing to acknowledge the need for more medical personnel to adapt to the Affordable Care Act, why can't we use the same obvious logic to expand Medicaid in Michigan and secure federal funding for health care? The Affordable Care Act is law, and those who don't like it can either face the facts and adapt or stubbornly stick their heads in the sand and sit on their hands as our state misses out on billions of dollars in federal money. Not including Medicaid expansion in this budget is a significant failure on the part of this body to aid the people of Michigan. And as the chairman of the committee has stated, there are ongoing discussions about this. Let us hope that there will be an approval of Medicaid expansion before it is too late. As the Senate Fiscal Agency reports on Medicaid expansion points out, the discussion on expansion will be based more on the policy consideration than on potential fiscal impact. This is truly the case in this budget. As is far too often the theme with the budget process, party politics is again interfering with sound policy making. And yet, for another year, Healthy Kids Dental is not being expanded to the most populous counties of Oakland, Wayne, Macomb, and Kent. Healthy Kids Dental has a proven track record of helping Michigan kids and is well past time for the children in Wayne, Oakland, Macomb, and Kent counties to also receive the same care through this program that the rest of the kids receive in the other parts of the state that have the Healthy Kids Dental. Furthermore, this is the second year the Senate DHS budget will contain a number of $100 placeholders rather than the one concrete figures. How can we make financial decisions without hard numbers to know that we're working with? There are several significant flaws with the budget, and to that end, I am uncomfortable voting for it. This budget leaves so many issues open-ended and is literally leaving money on the table. And because of that, I will be voting no on this budget. Thank you, Mr. Chairman. I'd like to have my remarks printed in the Journal.